Today we're going to be talking about integrative medicine, what it is, how it can help us, who it's for. And we have Dr. Tina Marcantel here with us.
Hi.
And so when we talk about integrative medicine, what are we integrating?
So when we talk about integrative medicine, we talk about what's called naturopathic medicine and more of the conventional medicine. And what we do is we combine them for the good, the highest good of the individual, of the patient at hand.
So let's talk about our terms here. When we say naturopathic medicine, what does that mean, naturopathic medicine?
So naturopathic medicine is one of the philosophy is to get to the root cause of the problem instead of just, band-aiding the symptoms. Get to the root cause of a problem. Do a lot of teaching with the individual so that they will be empowered to take care of themselves and to be proactive with their health. That's a big one right there. And the other thing is holistic. We look at the whole person. We look, of course, at the body, the mind, the emotions, the spiritual. All of that contributes to the well-being of an individual. So when we look at conventional medicine, we look at more of the visits are shorter. There's more medication that's usually prescribed. I myself am not against medication. I prescribe it myself, but I also like to get to the root cause. So I like to combine the best of both worlds for the good of the individual.
So can we talk more about conventional medicine and what exactly that means in this context?
Conventional medicine is what we're more familiar with, is what we were brought up in. You go to a doctor, whether it be a family physician, a specialist, and there are tests that are done, and you're given a diagnosis, and then a lot of times you're given medication for it. So it's treating mostly the symptoms. Without always getting to the root cause. Now sometimes there are circumstances where they run tests and all to get at the root cause of the problem, but it is the visits are short term, and so there's so much that the doctor can do.
Do you feel like there is a conflict between the two sides of this integration, conventional medicine and naturopathic wisdom?
Well, it depends who you're talking to or with. For me, no, not at all, because my background is one of, I worked as a registered nurse in the hospital, in the clinics for 20 plus years, and then I became a naturopathic physician. So I look at the best of both worlds. Now, sometimes there's let's put it this way, a misunderstanding, maybe you can say, between physicians of the naturopathic world and the conventional medicine world. And that's why communication between the doctors is so important. And that's why I like to get together with if my patient is seeing a physician, a neurologist, endocrinologist, I like to get together and communicate about the individual and add my special sauce, my special education and information and ideas that I have for their plan of care. And then when we can work together if the person needs both medication, but also looking at their meal plans and their stress levels and all that other stuff, that is what is going to truly help the individual.
So what is one of the major misunderstandings that there seems to be between these two schools of thought?
Well, the misunderstanding is it comes from not having the knowledge of what the other does for the greater good of the patient. Maybe the naturopath may have a wrong perception of the doctors giving too many medications. Why aren't they trying to get to the root cause? And the conventional medicine doctor is saying, why are they, why don't they take a little bit more medication? And what is this about nutrition? Is it really going to help? We need to educate one another so that we can come together in a place of unity, once again, for the good of the individual patient, client.
So what kind of knowledge do you think that the patient should possess as they're thinking about their different types of care options?
The first thing, of course, is they have to consider what do they need? What are their goals, all right, for their individual physical ailment or disease or situation. More and more patients are becoming more and more empowered because of the internet. Now, the internet doesn't have all the answers, and sometimes there's too much read, but they are educating themselves more and they're becoming more and more proactive. So with some of that knowledge from both conventional and naturopathic information that's out there, they can start asking themselves the questions of what specifically do I need for my care? And where will I go, and what are the questions I have for that individual doctor? And a lot of patients that I see will always consider this. They will ask their conventional medicine doc if he or she will work with me as a naturopath, and I in turn will ask that conventional medicine doc we could share either through phone or fax or whatever, the information that's going on, the treatment that's been given, especially in, cancer patients. We need to know what the other one is doing. And we've kind of missed that out when I worked in conventional medicine. They were getting to be more and more specialists, which is awesome, which is great, but there was a lack of communication about what the doctor, the specific specialty, is doing for the patient. And then we get too many medications with too many side effects. So when a patient comes to me, I usually look at all the medications they're on and the supplements that there may be interactions with those, and are they sometimes they're taking the same thing double or even triple the same thing. So we're kind of the ones that kind of go through it, and it does take some time. But both worlds, they need to look at what's going on.